Hi, Dr. Eric Lund here, your local Roseville and St. Paul chiropractor. And the topic for you in this video is related to, is it my hip or is it my lower back that's causing my pain? So commonly, the hip can be referred to in many different areas. So sometimes we'll say my hip hurts, or a patient will say that my hip hurts, and then what they'll actually do is they'll point to their back or part of their pelvis. And so the first thing is that you need to distinguish between a hip and lower back is truly when we talk about the hip, we're talking about the front part of your leg versus anything in the back or in the pelvis is going to be more of a pelvic or lower back problem. So is it the hip or the lower back? So a couple key things that will clue you in if it is a hip problem rather than a lower back problem. The first thing is the location of the pain. So if you're experiencing pain that is in the groin, generally that is going to be a hip problem. Another key sign that you could look for, or maybe you experience, is if you feel like when you cross your legs that is painful. Generally, if crossing your legs causes pain, there's a higher likelihood that it's the hip in the front that's causing your pain. Now, where this can get a little bit trickier is that your hip and your lower back can both cause or refer symptoms into your leg, more specifically the front of your leg. So if you're having pain in the front of your leg, that could be the hip or it could be the lower back. And one of the key things that you want to do is you want to go to a specialist, someone who specializes in the treatment of musculoskeletal problems. And what they're going to do is they're going to put you through a series of tests. And basically, based on those tests to the hip and to the lower back, they're going to help determine which is the main cause of your symptoms. So hopefully you found this helpful, and we'll see you next time.